Hi everybody, today I want to talk about mammograms. Mammograms are life-saving and they're very, very important for women to get at the age of 40 and yearly thereafter, or if they've had a first-degree family member with a strong family history of breast cancer, then that age may be determined between the patient and their gynecologist. I get a lot of questions about breast implants and mammograms, and I want to clear up some misconceptions. Let's talk about mammograms. So, as I mentioned, at 40 years of age, women should start getting yearly mammograms. Now, when we have an implant in place, and we're going to show that here, so the implant goes usually in what's called a dual plane, which is behind the muscle. So here you see the rib cage and the intercostal muscles, and here is where the implant usually lives, and then the muscle separates the breast tissue from the implant. So this is another way of doing the operation in which the implant sits on top of the muscle. So here's the rib cage, here's the pectoral muscle, the implant, and the breast tissue. So these are the two most common methods of placing implants in the United States. Now, the radiologist is trying to visualize all of the breast tissue. The implant is actually pushing that breast tissue forward. It does not interfere with the radiologist's ability to diagnose a breast cancer. And this is very important because there are women who do have strong family histories, so they are worried that they may have issues with a mammogram missing a breast cancer diagnosis. But this has been studied extensively, and an implant has never been shown to decrease the sensitivity for a radiologist to be able to diagnose a breast cancer. Occasionally, the radiologist will ask to see additional views, so they would have to take an additional view or two from the lateral side of the breast, but they can visualize all of the breast tissue just as they would be able to if the patient did not have a breast implant. I generally recommend waiting at least 6 months after the breast augmentation before getting a mammogram done. So if I have a patient who is already getting close to their appointment, so for instance 2 or 3 months before their appointment, I generally recommend doing it a little bit earlier since they won't be able to do it at the regularly scheduled time. So all in all, there are no medical indications for not putting in a breast implant in a patient with a family history of breast cancer out of fear of not diagnosing a breast cancer because they do not interfere.